Hello everyone, and welcome to Nursing to Do and to Be, your one-stop shop for health literacy. Today we have a very important topic to talk about. That topic is hypertension, high blood pressure. This condition affects several millions of people in the world. It's been published that it affects 26% of the world's population. That is over 970 million people are afflicted with this unfortunate disease. So it's very important to learn about it and talk about it. And the worst thing about this disease is that it does not have any symptoms. It's referred to as a silent killer because for the most people, you have no symptoms at all. So you don't have any indications that you have the disease or not for you to even follow up with your healthcare provider. It makes it very important for us to talk about so we can take good care of ourselves. Okay, so let's try to understand what a disease is. In a layman's terms, high blood pressure is pressure against the walls of your arteries or your vessel, and over time it can potentially damage your heart and bring you heart disease and other health complications. So high blood pressure is very important to talk about and to manage it well. Measurement of high blood pressure is by a device called a sphygmomanometer. Okay? And these days there are several automatic devices that we can use to measure blood pressure. It doesn't have to be done manually. So I think if you're listening to me today, you better get yourself one of those automatic devices so you can check the blood pressure regularly. It's important to be doing that. And how do we take blood pressure? The readings are in two numbers. It's like a fraction, a top number and a bottom number. The top number is referred to as systolic blood pressure. That is the pressure against your blood vessels when your heart is contracting. And then the bottom number is called diastolic. That is the pressure against your blood vessels when your heart is at rest or relaxing. As we all know from the previous videos, one of the major functions of our heart to be able to meet the needs of our body is to pump blood, contract, relax, to circulate food, water, oxygen, and other nutrients to our blood cells. So it's very important that your heart circulates effectively by pumping effectively. That is contracting and relaxing as it's designed to do. And when the pressure against the walls is too much that it damages the heart vessels over time, it leads us to high blood pressure. Let's remember that both the top and the bottom numbers are very important, and both numbers can lead to systolic blood pressure if the top one is the one that is higher, above normal, and then diastolic blood pressure if the bottom one is the one above normal. In some people, both numbers are very high, and that is not good. It's not recommended that it should be that way. Especially if you are over the age of 50 years, you should consider the bottom number very well. You should take good care of your heart and your bottom number because it determines your risk of heart attack or heart disease. So it's been published also that if your systolic is 20 millimeter mercury above 115 millimeter mercury, your risk of heart disease doubles. The unit of measurement for blood pressure is millimeters mercury. So if your systolic, for instance, is 115 today, and maybe in about 2-3 months it goes up to 135, you should be worried. It's gone up more than 20 millimeter mercury, so you should be worried about that. The same goes to the diastolic. Any diastolic, any 10 millimeter mercury increase or raise from 75 millimeter mercury, it's a risk for heart disease. So let's say your diastolic was 75 last week, and this week is gone up by 10 to, let's say, 85, 86, you should be worried and start seeking care. Okay, today is just the overview. So we're going to take deeper dives, and there are stages of high blood pressure that we'll be going to cover, and also the risk factors and other fun stuff. So thank you for watching so far. Until I come your way again next time. God bless you.